can't really fool anybody in the operating room. Everybody expects everyone to really be sharp, to know what they're doing, and to work together as a team.
You don't get out of school and stop learning. There's so many advances every single day in nursing, but in surgery too, and in peri-op. And I think for people to come in and just expect for them to just be able to do the same work every single day isn't realistic, and I feel like continuing your learning and seeing what is new and innovative is so important.
Learning is a continuous thing, and it's so important for all of us in medicine, especially today with the amount of knowledge doubling every couple of years, to continue our education and stay on top of things. It's especially important in nursing, I think.
We wanted our staff to realize that the work that they were doing was so impactful to our surgical patients. So when we found the program, the Take Two program from the CCI, the Competency and Credentialing Institute, gave it to the staff saying, we know that you're doing the work, we know that you are good at what you do. This is just a way to demonstrate to your peers and to leadership that you are doing all of those things.
Well, the nursing role is really vital because there's so much to know about what we do. You know, there are so many different specialties in surgery, and it requires quite a bit of training for them to learn each specialty and each of the procedures that are done within those specialties.
Going through the certification process was kind of bringing me back to nursing school with going through studying for the NCLEX, which is the state boards. There's a lot of information to take in, and I was a little nervous, but I studied within the 3 months that I had, and I took the test and I passed it the first time.
I feel like the engagement from our staff has gotten so much bigger and better, and I feel like the certification has a lot to do with it. It prompts a lot of conversations and with our staff that are certified. What can we do to keep this up and make our department better?
The knowledge that a nurse has is very important, and the experience that she has is even more important. We depend on longevity and retention of our nurses. We need them to help teach the younger nurses.
Being involved and taking on new staff, and because we have a lot of new grads that come in, and I think the staff that are really comfortable in the role that they've taken with being more involved with the actual department, they're taking on new staff and they're taking them under their wing and they're teaching them all the things, and they take pride in that.
I see things becoming more collaborative because everyone is talking to each other more. They're working together. If they have questions, they know who to go to ask. If they don't know, they'll come to one of the team facilitators and we'll help them find the answer, or we'll find that answer and we'll bring it back to them.
We have a lot of shared governance, and we have a lot of new councils that we've implemented in the areas. So I feel like staff's more involved in what's being done around the department. Whereas before, I just don't feel like we had, there was no attachment to the system. It felt like it was a very siloed department. And I feel that now that we've implemented all these shared governance, that people are able to see what's going on in the system that also pertains to surgery. They now have a say in all of those things.
The attitude has changed within the staff for certification. Everyone's trying to help each other out. There are people that have shared their notes for, telling each other this is something that's very important to look at. I didn't know this. Maybe take a look at this, that type of thing. Just kind of giving each other areas that you don't think about to study.
You don't get out of school and stop learning. There's so many advances every single day in nursing, but in surgery too, and in peri-op. And I think for people to come in and just expect for them to just be able to do the same work every single day isn't realistic, and I feel like continuing your learning and seeing what is new and innovative is so important.
We couldn't do without our specialty nurses in surgery.